All right. Thank you, everyone, for joining today. In today's webinar, Transforming Healthcare Utilization Management with AI and Automation. We're here to learn and share about Why is it important? What are some of the key challenges in a modern And what is the role of automation and AI in utilization management? A few housekeeping points before we begin. All registrants will receive a link to the webinar via email. It will be in your inbox Thursday morning, the 23rd. Unfortunately, we're not going to have a live Q&A session, but we do encourage you to leave questions because everything will be answered and sent to you via follow-up email. I want to introduce myself. I'll be your host today. My name is Jacob Rouse. I'm the Vice President of Intelligent Automation at Amitech Solutions. My role really focuses around making automation and AI accessible and meaningful to healthcare organizations. At Amitech, we're 100% healthcare focused. It's the only industry we work in. I've been here a little over 3 years in a variety of delivery and strategy roles. A large portion of my career was spent inside a health system where I was an executive over financial and revenue cycle areas, including overseeing utilization management and clinical documentation review. Now for the fun part. I want to introduce some amazing guests today. Today we have with us Paula, who's the CEO at Rivers Edge Hospital, and Crystal, who's the Director of for Clinical Services and Population Health at Arkansas Blue Cross Blue Shield. Paula, thanks so much for joining. If you could introduce yourself, tell us about you, tell us a little bit about Rivers Edge.
Absolutely. Thanks, Jacob. I'm Paula Meskin. Like Jacob said, I'm the CEO at Rivers Edge Hospital. We are a 25-bed critical access hospital located in St. Peter, Minnesota. If you know the map of Minnesota, that puts us about 65 miles south of the Twin Cities or Minneapolis, St. Paul. I've been with Rivers Edge for just shy of 16 years. I started as the senior nurse manager. A couple of title changes moved me into the chief nursing officer position. And for the last 3 years, I've been the CEO here at the hospital. I've got some background in labor and delivery and mental health before coming to Rivers Edge. And we are, like I said, located in St. Peter. We have a very strong orthopedic program. We partner with an orthopedic and fracture group out of Mankato, which is about 15 miles away from us. And we have developed a very strong program and have received recognition for our strong quality and safety that we provide for our patients.
Paula, thanks so much again for joining today.
My pleasure.
Crystal, could you tell the audience a little bit about yourself and ABCBS?
Sure. Hi there. Sorry, I was having a little trouble there. Yes, my name is Crystal Shoemaker. Thank you for having me today. I am a registered nurse, have been a nurse for almost 25 years now. Have some background in home health and working in the hospital and working in several different settings. Have been working at the health plan now at Arkansas Blue Cross Blue Shield for 12 years and have been the director for utilization management for a little over a year and a half now. Our Blue Cross just recently celebrated their 75th anniversary, and we are we're out in the community a lot, really support Arkansas and our providers in this state, and we're really active in a lot of community services and giving back to our community. So we really have a strong presence out in the community and working on health and wellness with our communities. And really, that's just a proud place for us to be.
Crystal, thanks so much for joining today. Before we officially begin, Paula, I'm going to start with you. Can you tell me your favorite thing about working in healthcare?
Oh my gosh, that is a tough question. I think one of the things that brings me back every day really is the fact that no day is the same. There's always something different that's happening. I can't narrow it down to one. I'm going to give you probably three. The people, certainly from both the patient standpoint and the coworker standpoint. So the people that I get the opportunity to work with at River's Edge here just really make me want to stay working in healthcare and make me want to stay here. But lastly, really, one of the reasons that I think I am probably the most proud to be in healthcare is really to work in areas where we can make sure that we can provide, especially for us, safe patient care for the rural population. I grew up on a small farm. I just like to make sure that people like my parents and my friends and family are able to receive care close to home.
Thanks so much for sharing that. Crystal, same question. Your favorite thing or some of your favorite things about working in healthcare?
So I guess it goes back to the community piece that I was talking about with Arkansas Blue Cross Blue Shield. I work being in home health for so many years. I love being part of the community and love giving back, being a part and making relationships with the community and making relationships with my patients and their families as well. Looking for, just making their journey better, just being proactive for my patients and ensuring that their journey looks better with outcomes. I'm really big and proactive on looking at our outcomes as a nurse and in a health plan, looking to see how do we drive better outcomes, how do we make improvements, how do we really look at we call them, our members. How do we look at the members and look at their outcomes and how is their journey going and how can we be effective as a health plan? And as I'm also a certified case manager, and have worked in that area as well. How do we give back to our communities and to ensure that we're here to help them along their journey? And that's what I love about healthcare is just being able to be a part of other people's journeys.
Perfect. Thanks so much for sharing. Now, the first few minutes here, I want to talk about some of the current challenges in utilization management. Obviously, the voice of the industry is loud. There are plenty of challenges and inefficiencies. Costs are escalating, compliance burdens keep going up, and we have clinicians spending too much time on computer work and not dealing with humans like they should be. So the first question I want to ask is, from your perspective, what are the biggest challenges to reducing inefficiencies in utilization management? Crystal, I want to start with you.
Okay. I think, well, number one would be a lot of the manual processes. There are a lot of authorizations and approvals that require a lot of manual input from the staff. The staff overload, there's a lot of work and a lot of reviews that have to come in and have to be reviewed by the staff as well. And provider frustration, trying to decrease the frustration for our providers and build relationships with them. And having to require a lot of the repetitive documentation and everything from the providers. I know it's a burden on them and it's a burden on us as well. And that's those are some of the things that we really need to work on to make those relationships better.
Thanks so much. Paula, same question. From your perspective, some of the biggest challenges to reducing inefficiencies in UM.
So Crystal and I share probably a few things, and one of those is really going to be the manual process. Starting from the standpoint, and I'm going to break it into a few phases maybe here. One of the first portions is the prior auth, and really trying to get a handle on what do all of the payers want from us, and trying to be able to make sure that we're meeting the expectations for each of the payers. Then, and we're manual and we're a small hospital, and so we don't have a large staff that's doing this. So the amount of time that it's taking our person to do that sometimes gets difficult to manage depending on what our census looks like. The next portion of that is really what are the expectations of us as a healthcare organization for the payers while the patient is here. We have an electronic medical record, as I think almost everywhere has an electronic medical record. And one of the challenges is how do we make sure that the payers can access the information? And then how do we make sure that we can use that effectively? So we actually have a payer that if a patient arrives, they require a prior auth for the patient to come. And then we have to provide them information either by phone call or email that the patient has arrived and what time that happened. Any change in their status while they're with us needs to be reported. And then when they're discharged, that also needs to be communicated out. For us, it's very inefficient to have our small staff making those calls. And for me, it just feels like they should be able to pull that from our documentation. We know when people come in, we know when people come out, and so how can we streamline that? And then I think the last portion of that really falls, Jacob, to the denials and how we're able to, again, manage what the payers are looking for, and then be able to process a clean bill and to be able to process that quickly so that we can get paid, and not have a lot of money sitting in the accounts receivable. And then that's from the hospital standpoint. From the patient standpoint, they want the same thing. We want to make sure we're getting them a timely bill or a timely claim for them, because we've had situations happen where the patients are unhappy that they've lost some of their HSA dollars to be able to help pay for that because we haven't been able to get a clean claim or a clean bill, and the amount of time taken from our departments to keep providing those pieces of information back and forth. And we get calls from the patients with their unhappiness about that, and Crystal may receive those as well. But those, I think, are the biggest challenges for us here at River's Edge.
Thanks so much for sharing. A slightly different direction I want to dive a little bit deeper into is more from those that are providing care. The impact of these manual workflows from a clinician, their satisfaction, their efficiency. Crystal, maybe I can start with you.
On the provider side, they're unclear of the guidelines that they're, to fully understand. And we don't always fully understand what the provider doesn't understand. And then we're also trying to administer a lot of guidelines for different groups and different plans. So I think that there's definitely there's a lack of transparency for the staff on both sides of the house.
Absolutely. Paula, I'm going to point the same question towards you.
Yeah, I think one of the frustrations, and for sure one of the biggest inefficiencies, is just the amount of time that's needed to send the requested information. Again, trying to make sure that we're matching everything that each payer wants, trying to anticipate those needs, and then when there's a denial or when there's more requested information, it's often a fax. So there's still some I call it old school work that's being done, trying to get the payers some of the information that they're needing. And, it's not a very rewarding position we have a nurse that sits in our utilization review chair. And, I think she gets frustrated with having to continuously send the same information to different providers. And, we do our best to figure out how we can get ahead of that. What is it that we're sending the most often so that we can make sure that it's there ahead of time. But I certainly, that's a frustration. And then finding somebody that can cover her when she's off because of the importance of her role, to be able to backfill that and then not have somebody that's there to do that on a routine basis. It's hard to stay current with those things. From the provider standpoint, we've moved to many of our procedures and reasons for hospitalization that used to be inpatient. Many of them are outpatient procedures now. Even admissions from the emergency department to the med-surg department. We spend a lot of time with the providers trying to figure out, is there criteria that's being met for an inpatient, or are they an outpatient? And if we're incorrect, what that impact is to our bottom line. So.
Thank you both so much for sharing. Another area I want to go into. We're all in healthcare for the same reason, and depending on where and how they interact in healthcare, we might call them a patient, we might call it a customer, we might call it a member. At the end of the day, it's humans receiving care for what they need. I'm certain, based on both your backgrounds and what your passions are, that's what brought you into healthcare. You already shared that's one of the things that keeps you in healthcare. So a follow-up question that I have for you, and Paula, you already started to mention some of this. What do you see as some of the biggest impacts on patients or members caused by utilization management? And maybe this time, Crystal, I'll start with you.
Okay. So I think one of the things that I was talking about earlier was that lack of transparency. The providers knowing what we're needing, what guidelines that we're following, and what, are we wanting an inpatient? Are we wanting an outpatient? And knowing those guidelines, but also thinking about the complexity of a health plan having many different group plans. And they're the hub for all of these different health plans, but they're all different. So for a provider, that is very frustrating because they have a health plan that they're responding to, and they're having to respond different, giving different documentation, getting a different amount of days approved or not approved, different tests that are required for one group versus another group. I can see that transparency is one of the things that we really have to work on between the provider and for us. And for us, that is also an administrative difficulty trying to maintain all those different groups and to ensure that we're following the exact guideline of what needs to be followed for each group. And so I could only imagine on the provider side how hard it is to respond to all the different guidelines that are needed.
Terrific. Paula, you did already mention some of the struggles from a patient standpoint, and a lot of it, the financial impact potentially. Anything else to add from a patient viewpoint?
Fortunately, I haven't been in this situation myself, but what we hear from the patients that we have gotten the calls from, and actually we've heard it from our own board members that have received care at the hospital when we're in a board meeting and we talk about the length of time that we have our days in AR and the amount of money that's sitting in AR. And, they will talk about the amount of time that it's been since they, really they thought maybe we weren't billing them because it had been so long. And really that is it's just the, I think, side effect of all of this that, we're working that claim that gets submitted. And if there's a denial, we'll rework that. And, we can go back and forth on a claim several times trying to get that to be a clean claim and really understand what's going on with that, the appeals that go along with that. And, it can be months sometimes before that happens. And again, if the one patient in particular that I can remember having a conversation with about this is we spread over the course of a year. So she had surgery in September in one year, and she finally got her bill after the first of the year. And so she had lost her HSA dollars. She again thought she wasn't going to have any portion of that bill to pay. She just hadn't heard from anybody. That patient in particular hadn't received an EOB. And so I can understand her frustration with all of that. And we really work hard to minimize those frustrations and do the best that we can to help manage those.
Thanks so much for that insight. Before we move on, I do want to recap. Utilization management, we've talked a lot about it. It's critical for balancing quality and cost, between balancing quality and cost from both standpoints. And if you think the trifecta, the provider, the insurer, and the patient, it's really around balancing the quality and the cost. Both payers and providers, the process involves an understanding what's appropriate, what's evidence-based, and then this brings in all of the juggling of those administrative burdens that you guys have, that you've shared. Summarizing some of those challenges, there's the clinician time on administrative work, there's duplicated efforts, disconnected systems, There's the effort of compiling and reviewing medical records, responding to inquiries, potential financial implications. If we're not careful, our patients and members can be negatively impacted by all of this. But this does lead me to want to explore a different topic. We've scratched the surface of this really complex industry function, but as we've been going through here, there's a key theme, and that's that strain between a payer and a provider, right? Both here trying to balance quality and cost and make sure outcomes are the best that they can be. But some of the strain, there's the timing, there's the rework, there's the financial implications. So the next area that I want to explore is, where do you see automation and AI reducing these strained relationships, making these relationships better to make sure that our time is spent improving the experience or improving the outcomes and not spending our time on the administrative work back and forth? So maybe Paula, if you can start and just share your thoughts.
Sure. I believe that the burden is on both sides for sure. I can't imagine Crystal's role is any easier than the role of the staff that are here at the hospital. But one of the things that I think would be beneficial to both sides, and I'll let her, I won't speak for her, but in my own opinion, if we were able to come up with a way to have all of the payers get into the medical records and somehow create the opportunity to do that so that we wouldn't need to send so many things, that we could access quickly what's needed from the medical record. And again, everybody's got an electronic record. So how can we maximize that, not only internally, but as we move towards the payers? We've joked a little bit about this here at the hospital. When we think about moving to the next step, and as the claims have gone out and we anticipate that they're denials, how could we anticipate what they're going to be? Is there something, some sort of filter or something that could go into place before we submitted everything to make sure that we've caught all of those, to help decrease those denials and the rework? And I believe that when we submit that, there's a very quick review. In some cases, we get a denial back really quite quickly, and it seems like almost too quick for a person to really have gone through the record and really figured out if something was really missing. And so I'm feeling like there's AI on the other end sometimes. So for us, it's like, how can we get ahead of that, and what can we put in place to be able to match that, so that we don't have the back and forth with that and just be more efficient?
Thanks so much, Paula. Crystal, same question from your standpoint. And again, where do you see automation and AI reducing that strained relationship?
So that is definitely where I wanted to ping off of you, Paula. The EMR systems is definitely a place where we want to go, and we want to be able to grab everything that we need, the documentation wise, because we know the burden of having somebody to be able to send records, or even paying for a system to send us records. But the burden comes to having access to all the different systems, having all the different contracts to have access to systems, different user IDs, different things that you have to have for each system. And then you have providers that are still not up to par on that piece, that haven't gotten an EMR system. So you still have some outliers right there. But to be able to have access to the EMR systems in one system, or being able to have an RPA process where the system is able to go out to different systems to be able to grab what is needed, would operationalize a lot of inefficiencies that we have. Instead of having a clinician that we want them to work at the top of our licensure, is to have an AI system that would be able to go into each of those EMR systems and actually grab what it is that we need in order to complete that review, rather than using a nurse or even a non-clinical staff to look through medical records in order to retrieve what is needed in order to meet those guidelines. If we can get to that place, that would definitely be a burden off of the providers, and it would help us administratively as well.
I can hop back in for a second, Jacob, if you don't mind.
Yeah.
Wouldn't it be great if the Paulas and the Crystals of the world could work together and just get that taken care of so that, it's collegial and it's not, I don't know the best word, argumentative. It's probably not the right one, but that's what's coming to my mind. It's collegial, it's transparent, as she said earlier, and we can just get those things taken care of and without controversy.
Right. Yeah. I mean, if we can work together and be able to, you get what you need, I get what I need, and then we could even get our reviews done much quicker to get them out to where we can make sure that the provider gets the answer back so they can get them scheduled, get them taken care of, and get people on on the mend. It would definitely be a whole new world in the UM and provider world, and I would love to get there.
So as we move on, there is good news in this. There are solutions available to help start to bridge some of these challenges. So automation and AI platforms, and I'll specifically call out UiPath, they offer solutions that can really transform many processes using intelligent automation, which is that blend of automation and artificial intelligence. One that you called out that I specifically want to talk about is the integration and connecting of systems. If you look at two different systems and you're just trying to connect them, it can be extremely complex. It can be difficult to find the right calls from one system into another system. But when you have a platform like UiPath that's able to integrate in here, it becomes extremely flexible to take the inputs of one, tweak them in the rules, and then get them into the other. So if you start looking at the future of automation and AI, this one becomes extremely powerful. It's not a direct connection from system to system, which requires the custom connections and maintenance, but it's more feeding into a platform that's driven by AI, and it is extremely flexible and able to adapt to needs over time. There's obviously the robotic process automation. This is more used to execute on repetitive tasks. The amount of available AI reading documents, reading communications, summarizing, standardizing, making all of the complex medical records more simple, more understandable, more universal. We also have this emerging space of agentic AI, which is a kind of an artificial intelligence that allows a solution to be built that starts to act independently and make decisions based on your instruction inside a workflow. So there's many places that you can go to start to solve these the challenges between payers and providers and just provide an overall more efficient utilization management. All that said, automation and AI capabilities, it offers clear benefits. There's time savings, specifically to help with labor shortages. There's one, using the technology that continues transforming the world. We continue reading about how AI, every year it becomes more and more prominent in industries, and how individuals can enhance their daily work by utilizing artificial intelligence and taking away the repetitive work to make sure that their brains are going towards expert human work. So my next question, are there any financial or operational metrics you believe automation and AI can impact specifically in the UM space? Crystal, I'd love to start with you.
Sure. So actually, we've already had some things here that we're utilizing today. When you talked about administrative burden, and one of those is trying to retrieve medical records, and the providers are sending them in, and as they're sending them in, a nurse has to go out to look for those in a different system, retrieve those, put them into the system that we're working out of. And what we have been able to do with that process is to be able to have the system to go out and look at our queue of what authorizations that are out there. Then your system was able to go out and retrieve and compile all of the medical records, bring those back into our system so that the nurse has them. They're looking at this authorization, and then they go out and the system has already pulled those medical records. So the nurse can start looking for those rather than going out to two separate systems and looking for the medical record and bringing it back over. Your system was able to go out there and pull it and already have it up for us. So that has saved thousands of hours for our nurses.
That's tremendous. Thank you for sharing that. Paula, same question, just metrics. Anything that we do, we try and measure it, financial or operational metrics that you believe automation and AI can impact.
From the standpoint, I think it probably falls to the end for us, maybe, and looking at the percentage of denials, and then also days in AR. I think those are the two that I would see, and we track those currently. Things that we don't track that maybe would be able to help would just be the number of minutes, probably, or I would hate that it wouldn't be measured in hours, but number of minutes per claim that somebody spends prepping that and reviewing that and sending it out. I think from a productivity standpoint, that might be helpful. But certainly on the back end, the percentage of denials and the AR.
Absolutely. All right. Now, as we've been talking about the challenges and potential solutions, I want to go through some real life examples of AI and automation in utilization management. Now, Crystal, you already shared some of what's going on in ABCBS. So maybe I can go to Paula. Can you share an example of artificial intelligence and automation at River's Edge?
Yep, so I'm going to take us outside of the process, and actually one of the things that we've been working with Amitech on is some predictive scheduling. So we've struggled to right size our staff on our med-surg department. And it's frustrating for the staff, right? So some days we are overstaffed and some days we are understaffed, and we hear from people that are working that they're frustrated if they get sent home because we have too many staff scheduled, and they're tired of being called if we're short and we need pickups. And so really trying to take a peek at two portions of this. One would be the productivity side, but really trying to right size the staff for the day. And so we have actually gone out and we've provided our admission information, our staffing information, all of the little, I'll call them quirky things that happen that might impact staffing. So if it's homecoming at the college in town, if it's a full moon, if it, all the things, and we've provided that over, and we are very near to being able to have a final product that will give us that predictive scheduling, the ability to say on February 1st, you're going to need 6 nurses. And then for us, it's up to us to decide, do they go on the day shift? Do they go on the night shift? But here's what you need based on the previous 4 years of work that you're going to need on February 1st. So we're thrilled that that's going to be coming, and it will be here shortly.
Really exciting.
It is exciting.
So can you tell me a little bit about the experience of bringing this advanced technology into River's Edge? Just how your staff, how the project, how did they interact as you were bringing this in? Just can you go a little bit deeper into what was it like going from no advanced technology in the process to starting to transform towards a predictive analytics and AI world?
So when AI has been around for much longer than probably I can even recognize, and it's become pretty commonplace in just being able to talk about it. And when we first started looking at it, I'm like, yeah, I'm not really sure how AI fits with River's Edge. I'm not really sure how to do that. And as we started talking and just thinking about things, and it's like, oh yeah, that can happen. The staff, we haven't spent a lot of time talking. They know that it's coming, but because everything really was being pulled from admission, discharge, transfer information from the electronic record, we didn't need a lot of the frontline staff taking care of these things. We've talked about it intermittently at our staff meetings that it's coming, and we're really trying to hope that we can balance everything out and increase their satisfaction with the schedule and what that looks like. From our standpoint of providing the information to be able to support the build for the AI product, it's been frustrating because again, it's one of those things. So it's not just the payers that we have trouble pulling our information out of the electronic health record for. We had trouble pulling the admission discharge transfer information so that the product could be built, and figuring out how to run those reports. And a lot of it was a manual pull at first so that we could at least see that it was going to work. And then we've slowly moved to where we are now. And we've got the reports ready to run. We know where they're pulling from. We know where everything's coming back to. And now, like I said, very close to being able to pull that trigger on it. One of the things that we're going to watch for and what we're hoping for is not only is that employee satisfaction, but we're hoping that there's a financial impact to having a right schedule, right? So we won't be paying, hopefully, the pickup bonuses, the overtime for those shifts where we're short. And then, we have policies in place that limit the number of times that we can cancel people in a pay period. And so there are times where we're overstaffed and we just have to pay that. And so hoping that we can see the financial impact to that as well as the satisfaction.
Terrific. Bristol, you mentioned at ABCBS, one of the automations really going around the prior authorization process, that's taking the records, pulling them, compiling them, taking the administrative work of prepping away from the nurses so they can shift more towards the review. So kind of a two-part question here. Anything else you want to add with that? Or part two, anything on the horizon for automation and AI in the area at ABCBS?
So yeah, we're taking a look at the EMR systems and trying to see where we can tackle that. That's one of our number one things is, how can we decrease it? Really the focus, and I know it's hard from a provider to hear this, but really our focus is trying to build that relationship and try to decrease that burden that you keep talking about. And I look forward to even partnering with you to see how can we do that to make a difference. But we've utilized a couple of different things for processes. You all also helped us with a process that I'm no longer in that position, but the system was able to complete out a charting for a nurse when there really wasn't any further nursing charting. It was really just administrative work, just letting documenting that we were unable to reach someone and to finalize that call, and then to send a letter out to the member. And that took the burden off of the nurses having to finish out that when it's just repetitive work. It's administrative, just needed to get a letter out, need to finish that documentation and move on to the next member. So that also saved us a lot of time and administrative burden. And we really want to focus on whatever we bring in-house is how do we decrease the burden on our staff, and decrease just the processes that we have in the system accesses. The system accesses can be a burden for everyone. Updating, passwords and getting those accesses, and then having the other people that are behind the scenes that nobody ever thinks about is all the IT people that are having to keep up with these things and helping us update these things so the staff can continue on doing their work. All of those things take time, take FTEs to take care of those burdens. And so being able to use the AI resources to decrease these burdens of different accesses and getting these pieces of the puzzle. I always call it a puzzle because all the things that we're having to ask for from the providers, those puzzle pieces, in order to get them to put them in with the guidelines of what we have to do in order to complete our review. If we can get those puzzle pieces together and make it less of a burden on both sides, that AI would be very, very useful.
Absolutely. Thanks so much for sharing. All right. So just to recap a few things that we heard here, how automation and AI can solve for some of these challenges. And I realize there's the utilization management as well as the related spaces to utilization management. There's just the automation of repetitive tasks. We talked about prior authorizations, medical records retrieval, documenting. Paula, you shared enhancing data analytics with predictive models. So it's not just taking the data and analyzing the data, but it becomes more taking action on it and forecasting outcomes and having the technology do that thinking for you. There's plenty of opportunity to streamline payer and provider communications. A huge one that we talked about, really the integrated platforms to be able to take back and forth the communication from one system to the other system, and then the reconciling of all of that. At the end of the day, I think the most key result is just giving our care teams time back. So before we move on, anything that you think I missed? And I'll start with you, Paula.
I think that's a great summary. There's not anything that I can think of that I would add.
Crystal, anything you think I missed?
No, I don't think so. I think you did a great job. I did want to add a while ago just what I was saying as well. You know, the outcomes for the utilization management for us is to decrease readmissions for our members and you know, to improve their journey, and having the data of the reviews that we're doing and the data in an advancement using the AI algorithms in order to help us predict on readmissions is also another great place to be able to use the AI. And I think that that would be, you know, another partnership between yourself, Paula, and myself, you know, trying to decrease the readmissions. And, you know, those outcomes make a huge difference in AI, I think would be another advancement for that.
Terrific. Well, this has been an incredible discussion. Unfortunately, like all great discussions, we're starting to come to an end. If I could ask one final question of both of you, if you could leave our audience with one key takeaway about the role of AI and automation in transforming utilization management or just their operations, what would it be? Maybe Crystal, I'll start with you.
I think trusting it, stepping back and trusting it, and allowing, you know, just going through the process and allowing everyone to be a part of it. And, you know, I think a lot of us have a lot of trust issues with AI these days, and just trying to figure out where to plug it in. But what I keep telling everyone is that, you know, these are processes that are going to make us work. We're not going to change. We're always going to need critical thinking. We're always going to need nurses to be a part of that. But just trust the processes and try to see where can we get nurses to be able to work, or any clinician to work at the top of their licensure, and trust the process of being able to take off the small clicks, and those small pieces will add up to a lot of hours. And trusting that, I think, is going to, you know, make a difference.
Love that. Paula, same question.
Yeah. Well, I'm hoping that there's organizations in the world that still haven't gone into the AI pool, and River's Edge wasn't the last one to get there. But I think for me, it was think outside of the box, and don't leave any rocks unturned. Don't rule it out because you don't think it'll fit. You maybe just need to ask some questions about how can AI help, instead of thinking that it can't help. And just taking the dive and asking the questions.
Terrific. All right. So Paula, Crystal, I want to thank you again so much for your time today and sharing your experiences, where you think AI and automation is going. To everyone listening, you're going to receive a link to the recording. Any questions that you have dropped in the Q&A throughout this presentation, those emails, those answers will be sent to you via email. You'll also receive a brief summary after this webinar. We ask that you take a couple minutes, leave some feedback so that we can continue tailoring our webinars to meet your needs and your interests. One final thought I want to leave everyone with. In 2024, a survey went out to a few thousand leaders in healthcare, and it found that 80% of leaders agreed that automation and AI is needed. Only half of those people understood where to begin their journey. So at Amitech, we pride ourselves on helping healthcare organizations enter this world of automation and AI. I encourage anyone listening, please reach out to Amitech for a discussion on where to begin, how to enhance, and how a customized assessment will set you up for success. Again, my name is Jacob Rouse at Amitech Solutions. I look forward to you reaching out and scheduling a discussion. Crystal and Paula, again, thank you so much for your time today.
My pleasure.
Thank you.